and good health. Each year in this country, we spend $2.2 trillion on health care, and 75% of all health care costs go to treat chronic diseases, many of which could have been prevented.
Well, Senator Mark Begich, a Democrat of Alaska, what do you think about what the Senate Finance Committee reported out last night? Are you in support of it?
Well, we'll see the final. I want to see the bill in total. That's one thing I've committed to my constituency, similar to what I did on the stimulus bill, that I was going to spend the time, as I did on that bill, to read it, understand what's in there. And this one's one of those where I want to see the details. There's obviously a lot of work that's been done, a couple hundred amendments processed through the last week and a half, so we'll take time and review it. And I know next week is their final vote.
Well, if you would, as a freshman senator, you're not on any of the committees that deal directly with the health care legislation, but as a freshman senator, give us your perspective on how the Senate operates when it comes to developing a large piece of legislation like this.
Well, it's interesting. It's a good point as a freshman. It's complex, jurisdictional issues. As you saw on the Senate side with the health care bill, the public, saw the HELP committee, the Health, Education, Labor, Pension Committee, kind of working its process. And the assumption from my constituency was, oh, that's it, because it's obviously a health issue in the Health Committee. Then, as you know, it goes to the Finance Committee for the money part, and then my constituency start calling and saying, I'm not sure what's going on there. I thought the bill passed. So it's a complex process. You have to recognize, like climate change, when it comes down, it'll have 5 committee jurisdictions. In some ways, it's it's frustrating to some degree, because as a local government guy that was a mayor and a local assembly member, you just kind of put the item on the table, everyone engages, you have your debate and your back and forth, and then you make a decision. In this process, even when you thought you made a decision, there's another decision still to come, and to come, and to come. So I think, I use the word frustrating not in a negative sense, but just that it's complex and you have to understand everything's moving. On healthcare, I have to say, even though members and many of the freshmen don't necessarily sit on those 2 committees, we're engaged because the public is fully engaged. And I just had 2 large town hall meetings last weekend, and the public is interested in a variety of for a variety of reasons. But you force yourself to be engaged even when you're not on the committees, because this issue is so big. But it is a complex system. Then you have to always remember, whatever you do on the Senate, you still have the House. And then when they're done, you still have the conference committee. But one of the things I've tried to do is understand the process, spend the time on these larger pieces of legislation, going to meetings where maybe I'm not a member of the committee, and just kind of get a better understanding, and take the time to review the material, which I know in this world in Washington, D.C., it's very difficult. But I also know one thing, that whenever they say, here's the date we're putting out a committee, usually that gives me a couple more weeks, because that usually doesn't happen. So I hate to be such blunt and honest about it, but that's the reality.
It looks by the Alaska press that you're getting a little beat up about the public option issue.
Yes.
What is your position on the public option?
Well, my position has been that, and you're right, it's kind of it goes both ways. My last town hall meeting, you had people who didn't want the public option, then you had people who did want the public option. I think the most important part of whatever we do in healthcare is to ensure that whatever mechanism we put into play, and there's discussion of co-ops now and exchanges and so forth, that we end up making sure that insurance companies are held accountable, that we make sure we have a balance in the process of making sure we have affordable health care. What I have said is health care reform, health insurance reform should not live or die by the decision of, is there a public option or not. I think we put so much weight on that, we are forgetting a lot of the other stuff that people are very interested in, pre-existing conditions, and making sure you can't be denied for that, making sure you have limited out-of-pocket expenses, removing lifetime caps. So my position is, as it moves through, and actually I had a reporter ask me, they said, does it matter if it's in the bill or debated on the floor? My response was, either way, it's going to get debated on the floor. The goal has to be, whatever mechanism we put in play, that we make sure that it helps and holds accountable the insurance companies on affordable rate structure.
You're also a member of the Armed Services Committee. Want to get your quick view on U.S. policy in Afghanistan, if it's time to send more troops?
I was back there in early spring, and what's happened since spring to now is dramatically different. When I was back in spring, I felt fairly confident that things were moving in the right direction. As we look at it today, conditions have changed on the ground. I think the report that McChrystal has put out is a good read at this point. I'm glad the President is having the aggressive debates, as we read a little bit yesterday and heard yesterday. My position is going to be I'm anxious to hear the response from the President, but also the military leaders, because we don't want to make this a political back and forth, as I think has already started. When I was looking from the outside in the debate on the Iraq War, as it got to certain points, it turned into more politics than what's the right decision. I think in Afghanistan, it's in the best interest of this country to let the President have his discussions with his military leadership, prepare a response and a proposal to Congress, and then that's when we should engage with not only the President's folks and then the military to make sure we're on the right path. I don't know if the right answer is more troops, but we're going to look at that. But the other piece, which is critical, there's no question in my mind from when I was there in spring and now, we have to put more trainers on the ground in order to assist in the effort of ensuring they have a strong military and a police force. That, to me, if we can't help them get the ability to govern themselves, we're going to have a long-term problem. But I'm anxious for the President's report and the debate that's occurring now.
Senator Mark Begich, Democrat of Alaska, is our guest. First call for him comes from Katie in Loch Sheldrake, New York. Please go ahead, Katie. Independent line.
Good morning, Peter. Good morning, Senator Begich. Thanks for your work for the American public in the Senate.
Thank you.
And I have actually one remark, and I'll end it with a question, a quick remark. But the American public is really watching this with tremendous scrutiny. It affects all of us. I, for one, am a big C-SPAN. I live and breathe on this channel, but I'm not the only person. Everybody's watching this with real intent. And when the Senate went out for the August recess, and we were given relative assurances by both parties that, they needed this break, they were going to come back in a true sense of bipartisanship, nonpartisanship, and be able to work on this health care reform with really open minds. What I'm finding as I watch, at least through the Senate Finance Committee and the recent Baucus bill that was put forth, I watch on these little markup votes daily what's going on. And at last count, what I've seen, and I watch across the board how the voting is ensuing on just the little amendments, where the Republicans are holding back on, any of, and by the way, thank you very much. I love the way you phrased accepting the idea of a public option by whatever mechanism it's called, that we really do need something like that for true competition and accountability. But whereas I understand at last count, there's been over 160 Republican put forth amendments to Baucus that the Democrats have voted on and certainly have allowed into the bill. By and large, on any of the Democratic amendments that are put forth, if it weren't for the fact that committee is more well-stocked with Democratic votes, as a bloc, the Republicans are trying to thwart any of the reasonable amendments at any point. But with that in mind, I would also like to say the biggest problem that I've seen, and I hear I'm not that...
Katie, we need to wrap this up.
I want to know why they're allowing, I forget who put this forth, to say that this Baucus bill, before it actually leaves the Finance Committee, saying that it would have to be put forth in full legislative language as opposed just to as things normally
All right,
would
thank
be.
you, Katie.
Let me, that's a great question that Katie has, and that's the complexity of how, again, you asked me about the process. The HELP Committee puts it in legislative form to debate. The Finance Committee, not only this legislation, but in past legislation, they always put it in a, kind of a discussion document, a concept document, but very detailed. So it's in plain English, so you understand what you're talking about on each section of the code and each section. I think there was an effort to say, look, put it in a form that the public, in its legal form, and then put it on the website. My position is, as much as we can put on the website, absolutely. That current bill is on there. What will happen is that bill now will go to the finance folks to score it, the CBO. They'll score it, give us kind of a financial cost to it. Then when it comes to the floor, we will get it in the legal form, and it will be yay thick. And along with that will be this narrative, which is very important. And so there is kind of a push to more, I believe, kind of delay tactic versus the way it's been working for decades. And I think there is this kind of misperception out in the public that the Democrats don't want to tell you what the bill is. That's just not true. I mean, the idea was get it done so then the law writers can put in the detail, come back, get it scored, and then put it on the floor. We will see it. The public will see it in its full legal form when it's time to vote. I'm sure they'll be excited to read that form. I would hope they read the narrative, too, because that will tell them a lot more about the bill.
Sam in Central City, Kentucky, you're on with Senator Mark Begich.
Good morning, Senator Begich. I'm glad to be talking to you all this morning. I have some criticism about the whole process, and I am a registered Republican, but my criticism is not just for the Democrats, it's for the Republicans as well. I think what we're seeing here in this country, and I think why there's so much fear, it's not so much about misinformation so much, but it's a lack of trust that the American people have with our elected officials, especially those in Congress, because we just don't feel like you take us seriously in these things. You know, give you an example of this. President Obama gave his speech to the Joint House of Congress, and he said that certain things will not be in the bill. Congressman Wilson shouted out, "You lie." And I think that was wrong for him to do that. But by the same thing, we find out in these past few weeks that these things that President Obama said would not be part of the health care plan are trying to be included by members of Congress about illegal immigrants receiving this health care thing. There's 20-some-odd congressmen who are pushing for that.
All right, let me
try, Sam. That's a good one. And I will be very frank with you. I think from how it's been put out there, the health care bill, I'm not sure that Congress has done a good job in that, communicating the elements of it. What you'll always hear, I mean, here you have the president kind of put his marker down on what he's interested in. I'm sure if you asked the president if he could control all 435 House members and 100 Senate members, he'd be very excited about that. The problem is you have very diverse personalities, so you're always going to have people who have certain ideas from very far left to very far right. That's just the process we live in. Because 20 congressmen are suggesting this idea, which is not in any of the Senate bills, I will tell you that. There's no legislation that's pending in front of the Senate and either one of those committees that allow illegal immigrants to get health care. I think you're always going to hear that. So then what happens, and C-SPAN is one of those that gives you more time to talk about these issues, but what you see then is 20-second, 30-second, 15-second clips, and before you know it, everyone thinks Congress is doing it. And the reality is it's everybody, and because of the body, the way it works is, the great part of it is everyone can put their ideas on the table. The problem, of course, with that is the most extreme ideas are the ones you read about first. And I think in this case, Sam, it makes a good point that he feels like the fear and the trust, the fear that has been created or the lack of trust. We haven't done a good job in communicating the elements of the bill and recognizing that we have to be honest with ourselves that there are going to be people who have very extreme ideas on both ends within our body, but that doesn't necessarily represent the final outcome. And that is a tough thing because you cover the process, and the public, as I said earlier, felt like the help bill was it. We were done. And the reality was we were just starting. And so I think we have to do a better job, and I mean both Democrats and Republicans, communicating this process and how it works and helping people see that ideas are going to pop up. Some are going to be crazy as all can be, and some are going to be very solid ideas. But that's the greatness of our system here, that no one is denied the right to put an idea on the table. And so I understand the gentleman's, but on the Senate side, there is no language of any kind that's allowing illegal immigrants to receive health care.
What's unique about Alaska when it comes to health care?
Well, I think we're on the tip of the iceberg, for example, on Medicare. And what I mean by that is doctors who no longer take Medicare patients. We have a significant draw in that arena, and it's because the cost, the reimbursements, the lack of primary care doctors, but that is a huge challenge for us, and the remoteness. If you're living up in western Alaska, out in the village and the primary care doctor may be 200-300 miles away, if at all, it becomes a very big cost factor. But Medicare patients are finding it harder and harder to get access to a doctor, even if they got coverage. It's just the access, because the Medicare system, we have a higher cost of Medicare up in Alaska in the sense of our medical procedures. That's a huge challenge. The other challenge we have is we have about just under 80,000 veterans, largest per capita in the nation. We have no veterans hospital, but we're working with the military to develop a cooperative effort between vets, clinic, and our Elmendorf Air Force Base Hospital, the first one like this around the country, very unique, and in order to provide the needed service not only for active but also our veterans. So, we have very similar problems like everywhere else. How do you get a primary care doctor who has a $350,000 loan to say, geez, now will you go make $150,000 being a primary care doctor, and don't worry about it. You'll do it for the good, and don't worry about those loan payments you'll fall behind on. It will all work out at the end. So we have that same challenge. We have a nurse shortage like everywhere else in the country. But I think we have several in kind of the shopping list, but docs for Medicare patients, and I think we're on the tip of the iceberg in the sense of what we're experiencing and what I think the rest of the country will experience.
What percentage of the population lives around or in Anchorage?
Anchorage is about 43% of the state population, and then when you include what I would call Matsu-Borough, which is just about 30-40 miles out in that kind of surrounding area, and then a little bit of Kenai again surrounding, it's about 60%. So it's a fairly significant size in a very concentrated area. And it used to be, I was born and raised in Alaska, and it used to be if you wanted major medical, you go to Seattle. Now we at least have a cancer facility, a heart institute, but it used to be if you had any heart issues, you'd be flown out. And from an economic standpoint, we saw a lot of our economic dollars being exported out, so we created a better system. We have one of the top nursing schools now in the country, but still, like everywhere else, we have our premiums, we probably have the highest cost of non-insured cost in your premium, meaning that when you pay your premium, about $1,900 of that is for the uninsured, where you hear most of the discussion from the president is about $1,000. We're probably one of the highest, $1,900. So it's fairly significant. Now, saying that, I will say last two things on this. Elmendorf Military Hospital has been rated now twice in a row as the best hospital in the whole Air Force, in the whole world. Our native hospital there has just won multiple awards because they have done a unique approach to health care. They've reduced their emergency room entrance down by 50-60%. They're looking at holistic medicine. Unbelievable experience they have there.
Next call for Senator Begich comes from Alexandria, Virginia. Margarita, Democrat.
Hello, Peter.
Hi.
Hello, Senator Begich.
Yes.
I want to make a couple of comments on health care. You had some suggestions on health behavior for people. I don't think that does anything to advance health care reform. Number one, you cannot legislate people's behavior. We need to cover everyone. And what is being promoted right now is way too complicated. If we cannot have a single-payer program, then a public option has to absolutely be contained in the health care reform. And yes, we need to use the word taxes. Taxes, we need to pay extra taxes to get these benefits. We want things for free in this country. No, we need to pay taxes. And that's all I have to say.
Thank you. Let me, my experience as a former mayor, when I took over as the mayor, we had healthcare costs going up for our workforce, our 3,000 employees, averaging 10, 11, 12% each year. We examined the situation. We brought it in-house. We put in a wellness program. We paid people to go do certain tests, be living a healthier lifestyle, incentive programs. Net result is when I left the mayor's office after 5.5 years, that increase was down to less than 1%. And my belief is if you manage it well, you can have good outcome. And it is, and I guess I disagree with a little bit of the caller's comment that you can't legislate behavior. I agree with that part. But if you give incentives for people to live a healthier lifestyle, don't smoke, do preventive care. 81% of our costs for Medicaid in Alaska is chronic illness, preventable disease. But because we don't have a strong and robust preventive care in our Medicaid systems, we don't have incentives for people to move in that arena. I know we did it in our city in the sense of our 3,000 employee group, which was an aging workforce, and we had a positive outcome. I just met with a half a dozen business leaders, large business leaders, who have the exact same kind of response. Not saying, well, we're going to just cut benefits, but actually rearrange the deck so people become living a healthy lifestyle. One, for example, pays their employees $600 to go get a full physical and everything else that's related to it. Net result, they have seen lower costs on long-term health costs, meaning they caught, and he gave an example of less than about a dozen people who were basically heart attacks waiting to happen. And he calculated what that cost would have been. And instead, he got them on a preventive program, a wellness program. Net result, these folks didn't end up in the hospital and emergency ward. So you can't legislate behavior. I totally agree with that. But you can create incentives, economic incentives. And matter of fact, the gentleman said to me yesterday, he says, yeah, I told this doctor what we did. And he says, yeah, my patient, I've been telling him for years he needs to live a healthy lifestyle. You pay him $600. Next thing I know, he's living a healthy lifestyle. So we have to figure out the right incentives to move people to better lifestyles. Because at the end of the day, if you're living a healthy lifestyle, you're paying for someone who's not healthy. And we pay that cost. So it's in our best interest to try to tap that down as aggressively as possible.
Next call for Senator Begich, Miami. Raphael, Republican. Hi. All right, Raphael, you know the rules. We're going to put you on hold till you get that volume turned down. A little bit of a delay. You'll be able to hear the whole thing through the phone. In Charlotte, North Carolina, Antonio, independent line. Please go ahead with your question.
How you doing, sir?
Very good.
Yeah, I just want to ask Mr. Senator if it was like, how do we go from wanting competition to the health insurance companies to all of a sudden demanding that the people who doesn't have insurance have to get insurance with these companies, and there are basically no rules. So, and if we don't get insurance, then we're going to be fined, or perhaps just see trying to put a stipulation there about going to jail. And one more little short question. The second question is that Republicans are always talking about economics and job loss and all of that. And how is it that only the president is the only one that ever mentioned that the bills that they have given to give companies all these billions of dollars, hundreds of millions, perhaps billions, to moving jobs over to China and India and probably going to Pakistan and Afghanistan eventually. And yet no Democrat ever talks about that when a Republican bring up things about job losses in America.
Two questions. One on the health care, and that's on the mandatory issue. That is great debate right now, and I think there's the argument is if everyone's in, then it kind of creates an equalizing force in the sense of costs. I'm one of those that are cautious on this because I don't think we got to be very careful about mandating certain things. At the same time, I understand the economics of the argument there. The one thing he mentioned there, going to jail, I've heard that now a couple times. That's one of those moments you hear someone might have said it on the floor or something. That's not in any bill I've seen. Is there a cost if you don't get insurance? That's being debated at a variety of levels, but there's no jail time that I'm aware of. But that's one of those things that kind of churn and burn out in what I call the high-speed, fast media, that you just lose track of what the reality is. But his question on the jobs, this is a great new debate that's about to happen, especially around climate change. Because the big argument about climate change and energy is it's the new economy. As the president has laid out, this is opportunity for us to expand our economy. And here's one point, I'll go right to what he said when, I think it was 2-3 years ago, the requirement was we're going to change our light bulbs, and by 2012, we're going to have more energy efficient light bulbs. Great idea, lowers fuel costs, better for the consumer, but no one talked about who would make those. So who's making them today? China. And so the net result is we exported a bunch of potential future jobs overseas because one of the, I think, deficits of this elected body down here, you asked me as a freshman earlier, is they don't look 3, 4, 5 steps down the road. They pass a bill, they move on. As a mayor, you always had to look 2, 3, 4 steps down the road. One reason is because if you messed up, you'd hear about it at the grocery store pretty quick. But it's also the right way to do it. And in this case, here we have this great idea on light bulbs. It's going to lower costs, lower fuel consumption. Everything is a gain, except we never thought about who would make them. Net result is China makes most of them. Walmart sells them and other stores like that, but the reality is we should have been thinking about that. That's what this new energy and climate change bill will talk about, and I think we'll have a great debate with the Republicans on jobs.
Raphael, please go ahead.
Yes, sir. Yes, Senator, Mr. Begich, if I got that name wrong.
That's good.
I just want to say a few things. You know, they try to sign the bill in the middle of the night, so, you know, I find it hard to trust. Now, I'd like to see health care reform. You know, and actually I was like truant from watching Rush Limbaugh, you know, but I get my source from there. And I get my source from C-SPAN and other news. And I'm not a flunky. I'm very observant of news, and I like difference of opinions. But, you know, when you got to have tort reform. Because I remember since I was young, when their malpractice went way up. Ultimately, the bills for insurance went from free to you had to pay a lot for it.
Tort reform.
Let me, the president made an announcement during his speech to Congress, several weeks ago regarding tort reform that he's directed the Health and Human Services Department to move forward on demonstration projects, which I think is a good idea, because one of the issues on tort reform is we hear great variations on what it does or doesn't do. I'll give you an Alaska example. We did tort reform in 1997 in Alaska. The reality is the average cost for your service when you went to a doctor did not change. Insurance rates went from $6,000 to $12,000. So what we need to do on the tort reform, I think that's where the president is moving in a good direction, is he wants to do demonstration projects to see what works, what doesn't. Because there's a lot of talk out there what the value is. I can tell you from the last experience, I didn't see my insurance rates go down. My actual visit to my doctor cost did not go down if I wanted to pay cash for it. So we have to be realistic. Does it work or does it not? I think it's a very politically hot button in this bill and probably will be left out. But what the president is doing, I think, gives us some more information.
Have you spoken with former Governor Palin since she left office?
Not since she's left. I read the clips once in a while. You know, the most recent one obviously is her book, that's the last. I've known her for a long time. I served with when I was mayor. She was governor. So I've had.
Did you have a good working relationship?
Yeah, from a city perspective, I did. You know, we had a lot of issues that we had to face with the state because the state runs a lot of stuff. We had a strong mayor, former government, but we still had a lot of work with the state. So we had a good working relationship. I think it's amazing the transformation in a lot of ways. I mean, she's very popular at one point in Alaska. I think now it would be a different story just because of the politics that have gone on. And it's going to be interesting how it all plays out in the future. But we'll see.
Have you spoken with former Senator Stevens?
I have not. Matter of fact, when I got elected, election night, or a night after that, I made a call or two to, just to have a conversation, but I haven't talked to him since election. Actually, I hadn't even talked to him at the election.
Well, Senator Mark Begich, we appreciate your coming on and talking to our viewers here on the Washington Journal.
Very good. Thank you very much, Peter.
And the House is in pro forma today. There's no